But why don't we go ahead and get started? Welcome, everybody. Welcome to the BHI Telebehavioral Health series. In case you don't know who I am, my name's Brad Felker. It's been such a privilege to be a part of this series for the last several years. I'm a psychiatrist, works at the VA and the faculty at the University of Washington. So you've landed, and we have this wonderful community practice. If you're new, we've got all kinds of great friends I can see joining us each month, and it's such a delight, such a delight. So this is our Telebehavioral Health series, our 501 series. It's supported by the BHI and the NRTRC. Talk more about them next. Next slide, please. There we go. For those of you who don't know, the Behavioral Health Institute, BHI, is a training workforce policy innovation center. It's located at Harborview Medical Center. I'm not going to read the whole slide to you. You guys are all grown-ups and you can read. But basically, there's 4 branches to the BHI: clinical services, research program evaluation, training and policy and workforce development, and then you've landed with the digital telehealth service team. Next slide, please. We also partner with the fabulous people from the Northwest Regional Telehealth Resource Center. It's a big mouthful, so we just say NRTRC. They are a telehealth technical assistance center, delivers telehealth technical assistance, shares expertise through individual consults, trainings, webinars, conference presentations. Their mission is advanced telehealth, and NRTRC aims to assist healthcare providers and organizations in putting together quality telehealth for rural and medically underserved populations. Next slide, please. So 2 ways to talk to us today. We have the Q&A, which is ideally where you'll put questions for the speaker. Now, we try to hold all questions till the end because we find it just interrupts the speaker, but if there's something really important, we will break into the talk. If you got technical issues, ideally, IT type stuff, ideally drop that in the chat box. If you don't get it right, we'll figure it out, no worries. Next slide, please. Got to keep all the lawyers happy. None of us have any conflicts, if you can imagine that. No conflicts to report. Next slide. There we go. Keeping those lawyers happy. Please be aware that policy changes may take place after the original date of this presentation. Any information provided in today's talk is not to be regarded as legal advice. Today's talk is purely for informational purposes. Please consult with legal counsel, billing and coding experts, and compliance professionals, as well as current legislative and regulatory sources for accurate and up-to-date information. Okay, next slide. Got to thank these folks. They're fabulous for helping support this ongoing series. We couldn't do it without them. The Washington State Healthcare Authority, our fabulous friends at the NRTRC, in the Area Health Educational Center. Thank you, thank you, thank you for your ongoing support. Next slide, please. All right, enough of that stuff. Let's get on to the show. So you've landed with us today on our 501 series. It is my great pleasure and privilege to introduce our speaker today. Joe Forscher earned his bachelor's degree in psychology and a master's degree in community counseling from Southern Connecticut State University. He has also lived in Kodiak, Alaska, and Seward, Alaska. He embraces a solution-focused approach as a clinician and leader and describes himself as inquisitive, supportive, accountable, accessible, and creative. He has worked hard to develop self-confidence while reducing self-importance, and is grateful for all the wonderful and poignant relationships he has had with clients and staff over the years. They've had a profound impact on him and has shaped him to become the person he is today. So with that, I'm going to exit stage left and turn it over to Joe.
Hi, everybody. Thanks, Brad, for that introduction. So yes, I'm Joe, and I'll be talking, well, maybe having a conversation, hopefully, with you guys today about our clinic here located in Anchorage, Alaska, and just the title, Utilizing Telehealth, a Brief Treatment Model, and the Wellness Approach to provide culturally informed services to Alaska Native people. And let's see. In order to, I think, create the right mindset, we got to scramble our brains a little bit, because I want the folks that aren't in Alaska now to kind of come with us out into Alaska. So let's do a little brain scramble. And this is what Alaska looks like. This is a picture right outside my window. No, just kidding. But uh, uh, we're going to let Alaska speak for itself. And we're going to go over these major topics. And just to reiterate, if you have any questions, save them, put them in the chat box. I'm learning about this as I present it too. I was just talking to Topher and Brad before we started, and just the process of putting these slides together has created the opportunity for me to get a little bit of a different perspective on things. So appreciate this opportunity to chat with you guys today. So what I've also included is little here and there, little facts about Alaska, and you may know, or maybe now you do know, that we've got a lot of bears here. And I couldn't resist when I think about the bear, and we're talking about barriers, we have to say barriers. And I apologize and proactively and retroactively for that. I just couldn't resist saying that out loud. And I'm not sure how I feel about it once I've said it, but there it is right in the slide. So we are going to talk about our clinic. Oh, thank you. I see some good reactions. So we're going to talk about the clinic today. And I have been the director of the Behavioral Health Wellness Clinic, let's see, since February of 2024. And we're here today to talk about who we are and what our story is, and a little bit, I hope, about less about the logistics and operational elements of the clinic, and more about the soul of what we do and why we do it. We'll start by talking a little bit about the Alaska Native Tribal Health Consortium. We're a part of that very vibrant and innovative organization. Putting this intro slide together reminded me of a little story, and I was planning to say that it happened to me, but full disclosure, didn't. This happened in a I heard this story a few months ago in a meeting from our hospital administrator, and he was talking about a time he had a meeting at the Cleveland Clinic. And you guys probably know it's a well-known big organization, and he arrived at what he thought was the correct building, but didn't know exactly how to get where he needed to go. And a staff member saw his confused look and came up to him and said, "How can I help you?" And he said, "I'm here for a meeting with so-and-so." And the staff member said, "Yes, I can take you right there." And on the walk there, he just happened to ask, "So, what is your role here?" And the person said, "Well, I help save lives by making sure people get where they need to go." And he said, "Oh," he thought to himself, "That's a really interesting connection." So he gets to the office, and he's waiting for the meeting to be called into the inner office, and he starts up a conversation with somebody who's there who also works at the clinic, and chatting with him. And then he says, "Well, what do you do here?" And that person says, "Well, I help save lives by making sure people can access the data and the information they need in a timely manner, and the information is accurate." And it was a really cool uh, tale to tell, because everybody knew how they connected to the soul of what the clinic did. And so that got me thinking after that meeting, and I had a few meetings with our crew here, and we came up with our soul, and we help people learn how to lead meaningful lives. And if I was to say that same thing, I could say, well, I help people learn how to lead meaningful lives by making sure that our clinic staff has the appropriate resources that they need, and to remove any obstacles that I can to help them provide high quality services so they can help people with this. So let's take a moment to talk a little bit about the Alaska Native Tribal Health Consortium. It's a interesting, like I said, vibrant, innovative idea, and it is a nonprofit tribal health organization partnering with Alaskan Native folks and American Indian people that live here, and partnering with the tribal health organizations of the tribal health system here. And the idea of these partnerships is to provide these needed services that connect to healthcare. And it's a wide array of services, covers a lot of ground, and a lot goes on here. I think one of the hardest things I've had to learn actually since being here is navigating our system and learning where we fit into the system. And at ANTHC, we have a ambitious and lofty vision, but we're all very connected to it. It's nothing less than helping Alaska Native people become the healthiest people in the world. And we're all committed to that. And I've come to understand our place in the system because ANTHC has construction and engineering initiatives, and those initiatives help build strong communities. They're fundamental to expanding the infrastructure, and by doing that, they help the communities get better access to healthcare. And that helps us move closer to our vision. Since I've been here, I've come to understand that equally vital in that whole process is emotional wellness. And our behavioral health wellness clinic embodies this commitment too. We do it by providing culturally responsive services that honor traditional values, address historical trauma, and we hope to empower individuals through our services and fostering healing from within. So the Behavioral Health Wellness Clinic supports development of strong, healthy communities, one person at a time. And ANTHC, in partnership, is committed to shaping a comprehensive system of care that authentically meets the diverse needs of the people that we serve. And I fine-tuned that in the process of putting these slides together, and that's been very helpful for me to connect to. So a little bit about then our origin story is our clinic is a response to a directive from the board of directors that came about in 2018, 2019, and based on some community needs assessments, the board saw that there was unmet needs across the state. So we were purpose-built to address those barriers to behavioral health care in the communities that we serve. And the goal of our clinic is to provide this ready access. And we right now are scope of practice is limited to folks that are 18 and older, and we provide services statewide. Therefore, 100% of our services are provided via telehealth. Here's our mission statement. And we fulfill this mission largely by supporting the tribal health organizations. That's what makes us unique. I believe that we don't replace the tribal health organizations. We're a resource. We don't compete, we collaborate, and we don't supplant, we support. And so we do this because we're telehealth. We can create bridges to rural locations that don't have or might not have the behavioral health resources to meet all the needs of their community. And by creating these bridges, we can take the pressure off. And so the local services can provide assistance, support to maybe the higher acuity folks. And we then use a brief treatment approach and return the clients to their home services. And part of what we do, by the way, is help people learn how to use their resources, because some in the more remote areas, resources are limited, and we want to make sure that they're able to advocate for themselves and use what's available. If, or not if, as we drill down into our mission statement a little bit, we can see that embedded in here, intergenerational wellness means that we address historical trauma. It also means we aspire to provide culturally responsive services. I say aspire, it's an ongoing process for us. It's one of the areas that that I've seen since I've been here that, you know, just to be honest, it's an area that we said we were doing, but I don't think that we were. It might have been a veneer. So we have recommitted, rededicated ourselves to learning how to do this, and I'll address that in a little while about that journey. And then the easy to connect to means that because we're 100% telehealth, we provide tech support to folks that might need it, but we're also at the same time committed to the direct human contact. And that is, I think, in a nutshell, that's where the mission statement came from. Okay, so continuing to learn a little bit about Alaska. There's a lot of moose here. I don't know, I can't see anybody, but maybe raise your hand if you've ever had to wait in the parking lot before you entered your office because there was a moose in the front door blocking the entrance. I have several times. So yes, and that's pretty cool. I actually I value that. So let's take a look at our scope of practice. It's intentional right now. This is the original scope, and we hope that we can expand soon. But we help individuals with moderate acuity level behavioral health issues that are appropriate for brief treatment. Our services include open access group therapy, case management, comprehensive assessment, and individual sessions. By the way, just a word on the open access group, that the ready access that that I've referred to is connected to this. Once we do an initial screening on somebody and they're waiting for their first appointment with their individual therapist, they can attend any one of currently seven groups that we offer that they want. They're open access, and they can get immediate help that way. So when I think about this, it makes me think then about what our essential features of the clinic are. And we are culturally responsive. We strongly believe and are committed to this because reconnecting or being involved culturally it's been shown, and I got some resources here, as a protective factor. And we can be a conduit for folks to kind of reclaim the strengths in the traditional teachings and practices. And I had this conversation when I first got here, but what if somebody isn't connected in a daily, meaningful way to their culture? That's fine too, because our approach gives that person a chance to reconnect. And if they choose not to, that's cool too. But it might also help them start to think about how cultural factors may be impacting their behavioral health. And that's what it's all about, right? Is creating opportunities for insight. We provide statewide services, and I talked a little bit about our role with support and not supplant. We work with the tribal health organizations, and it's crucial that we do work with the tribal health organizations. Otherwise, we're not going to know what's going on in their community, and then we're not going to know how we can best be a resource. So the collaboration is a key, and again, our primary role is to relieve the pressure. So the statewide services are interesting, and because the state is so diverse and so different, it really is vital that through this connection with the tribal health organizations that we gain that deeper understanding of the uniqueness of each community. Another essential feature is we offer timely access to services. Early recognition, early intervention can really disrupt escalation cycle, and we try to get folks when they're ready for treatment before things become a crisis. It's an interesting thing that I didn't realize about the telehealth piece, by the way, is that we kind of provide a layer of insulation in the smaller communities where the confidentiality or anonymity of behavioral health care is challenging. By offering the telehealth option, we can help lessen that stigma and increase their likelihood that they can seek treatment. And now, really the star of the show is Alaska. And I think just going over a little bit how just the environment, geography affect or impact what we do. Those of you that live here know this, and folks that have visited us probably know it. And if you've ever looked at a map, Alaska is really big, and that can cause or create some challenges. But just to talk a little bit, put this in perspective, twice the size of Texas. We have an area larger than the combined areas of Texas, California, and Montana. Alaska is larger than many countries. For example, we're about 7 times the size of the United Kingdom. And so the sheer size um, create challenges. For example, a lot of communities aren't accessible or not connected by the road system. I mean, how many people live in a state that are here that live in a state that we can say, oh, that town is off the road system? I've never heard that in any other state but Alaska. And so we've been using telehealth in Alaska for over 20 years. And it's opened a lot of resources, and it's a valuable resource, but there's some challenges with it too. So so this is the 3rd time I've lived in Alaska, and it's different each time I come back and each place I live. But one thing is the same, that I always hear things are different in Alaska, and I understand that now, finally. So and things are different because of these kinds of things. Just the sheer size of the state, extreme climate, challenging terrain, unique geographical features. Actually, I should say, this is interesting. I think that I don't want to take credit for this, but our office here is located on the Alaska Pacific University campus, and we're in the same building as geologists. And one of those folks explained, let me see if I wrote this down, that the geographical features create a complex web of geographical hurdles. And I thought that was really well said. So I wanted to make sure I said that. And it impacts our service delivery. It impacts the development of infrastructure. It impacts the daily lives of the folks that live here. And just take a look at some of the cool things that that Alaska has here. So when we look at some of the barriers, and I'm saying it BAR, not BEAR, just because I'm not going to do that anymore. But we've got some interesting things that happen here. Alaska's prone to, get this, earthquakes, volcanic eruptions, landslides, wildfires. Of course, these can cause significant impact on just daily lives. The slide that stands out to me most recently is the coldest temperature, -80. I've never been anyplace that cold. The coldest I've ever experienced was when I was driving here in late January, early February of 2024. I came here from Vermont and thought it would be a good idea to drive through Canada into Alaska in the middle of winter. Anyway, I got into Alaska, and the first town that I got to was Tok, Alaska, and it was 48 below, and I couldn't leave for 3 days because my truck is manual transmission, and my transmission fluid said, nope, I'm frozen. You're not going anywhere. So it was just one of those things. Good. It was a great memory, though. So, providing the services to this larger of a region, obviously, we need to respond to the region, and we need to make sure that we're agile and flexible in responding to things. And here's some of the things that we take into consideration. And that we can mostly overcome through the use of the telehealth services. So I just showed you guys a whole bunch of extreme kind of factors that probably people don't look forward to. But I do want to remind people that we also get to see this. And that's the Northern Lights. And it's just the raw beauty and the power of where we live. It's just really energizing. And it's part of uh, how we can help people by reconnecting them to this. Okay, so that's a little bit about how Alaska shapes us. And then let's get into the cultural factors that can influence services. And we're going to talk about 4 of these factors. And, um, here's another area that in putting these slides together, that I gained some insight and kind of distilled my understanding of, for example, historical trauma. And so this is a very very brief, maybe just the essential elements of historical trauma, the ongoing impact of collective intergenerational suffering caused by past colonial oppression. And the research that I did led me to this phrase, which just even now, as I'm presenting this, takes my breath away. It revisits ancestral wounds on current generations. It's a factor that affects people. And ANTHC, and then specifically the Behavioral Health Wellness Clinic, we're very dedicated, committed to undoing some of the damage and moving forward on that. Impact of historical trauma includes these increased rates. Alaska is usually in the top 3 states of suicide rate per capita, suicide rate. The historical trauma affects the very, what's the right word here, fabric of the family structure and the soul of how Alaska Native folks live, because the culture was taken away, their language was taken away and replaced by the Western approaches. And I think this last piece is understandable, that there is a distrust and kind of factoring that in shapes the way that we build therapeutic alliance and build that rapport. On the positive side, there's a cultural factor. We don't want to forget that there's strength and resilience within the Alaska Native cultures, and these can be protective factors. And here's some examples of what folks can already have and maybe reconnect to. And we always want to be aware of this. We'll talk a little, in a little while, we'll talk about how we adapt, adopt, revise, integrate our practices into the traditional cultural values. By the way, this woman is Elizabeth Peratrovich, and back in the day, she led the charge to get the passage of the anti-discrimination bill. And she is a role model that I've become aware of for myself and other people, of course. But here's what she said during the public comments portion of the bill being vetted. and I won't try to use her voice, but I think it's important to give voice to it. But I would not have expected that I, who am barely out of savagery, would have to remind the gentleman with 5,000 years of recorded civilization behind them of our Bill of Rights. It's hard for me to comprehend that human beings that have been living in Alaska for tens of thousands of years um, had to fight for their rights. And that for me, I don't understand it, but it helps me. It helps me at least understand the immensity of the impact of the historical trauma. Cultural values uh, are a big part of what shapes services, and we try to remember that uh, these are sort of the pillars of just in general uh, this holistic view. And I have evolved as a therapist myself. I really agree with this idea that behavioral health can be seen as an imbalance, and to treat it not separately, but as part of the big human picture. So again, I'm repeating myself a little bit, but this is my third time living here, and I had an experience when I first got back to Anchorage. I went to the hospital for the first time for a meeting, and I saw the parking lot, and it had a area reserved for elders, and that to me just said, "Yep, that's putting your money where your mouth is there." The community, big piece, and the traditional healing practices. I'll never be a traditional healer. But I have the opportunity to bring those folks in. And you just look at the cultural competence piece. It's a phrase we use all the time, but again, to kind of break it down, we can define it: the ability of an individual or organization to understand, appreciate, and interact effectively with folks from different cultures or belief systems that are different than their own. Key aspects. Hope these make sense. And this next slide is kind of talks about where we're at under the heading of cultural competence. It's something that the idea that you can become competent and you can attain competency. I haven't experienced that myself. That so it was kind of disconnect with me in my personal, hopefully, evolution. I do agree that it's definitely a crucial requirement, but the core assumption that more knowledge translates into greater competence, I haven't seen that in myself or others. So I became aware of cultural humility, and it's a slightly different approach. It focuses more on it being a lifelong commitment and journey about self-evaluation and self-reflection. And I can speak for myself and my crew here. It keeps us in the zone about being mindful that we can see and appreciate the differences and the diversity within the cultures and the individual uniqueness. And again, the payoff here is that I'm naturally curious, and it promotes that curiosity, that other-oriented style, and this is definitely more aligned with person-centered care. And now, just putting it all together, we'll start with how do we integrate. Here's an overview of our treatment approaches. And we put together 3 of these elements: strength-based, brief therapy, and solution-focused. And maybe you guys are familiar with brief therapy. It's an interesting thing for me that in the beginning, like, I don't know, 10 or 15 years. I'm old enough, by the way, to say 10 or 15 years, and it means the same thing. I don't know when that happened, but 10 years used to be a long time, and now it feels like nothing. My original exposure to brief treatment was it didn't align with what I was taught, and how can we shortchange the client? I've changed my mind because it's not necessarily about the brevity of treatment. It's when we use techniques like solution focused that the time limited piece is almost a byproduct of how we use these techniques. And you'll have the slide for this, and people obviously spend their whole careers drilling down on what solution focused is. Here's some examples that might be helpful. I've become a big fan of it. It's appealing to me from a practical way, and it's just it aligns well with the culturally responsive approach. And then the strength-based core assumptions. We presuppose that everybody comes into it with these qualities. People are resilient. When I'm in the zone in my personal and professional life, I can see problems as a source of challenge and opportunity. I don't always do that. I can give examples this last night, but I always try to get back to that. And this last one is I've come to view it as a positive thing, but change is constant and inevitable. So let's learn how to navigate it. So over the years that the clinic's been around, we've combined these 3 approaches, and then that's how our treatment approach was born. The strength-based approach we use to empower the client, reconnect them to their strengths. Solution focus provides that direction, and the brief framework is that time conscious. The limited sessions creates urgency, and we navigate the urgency so it doesn't turn into anxiety, and we try to use it as a motivator. The wellness approach is the foundation for everything. It aligns well with the brief solution focused strength based, and here's how we think and have experienced the alignment. And in general, it's a good fit for us because it reminds us to use the holistic approach. And here's the factors that we want to stay mindful about. And so here's the evidence-based practices, and hopefully you're familiar with these. We don't have time right now to get into the nitty-gritty of these approaches. They work well together. We also use other evidence-based approaches, but these are the 3 main pieces. And the trauma-informed care, as we've talked about, significant historical, intergenerational, ongoing systemic inequalities, and the trauma-informed approach is essential for working with our folks. And people that use it, we are always seeking to get a deeper understanding of the factors and how it impacts people. The cognitive behavioral approach can be adapted to address trauma-related issues, and here's how we adapt it. Storytelling, it's not only great to tell the story, it's great to listen to the story. And so we help our folks explore their own cultural identity by using curiosity and asking questions. And then the acceptance and commitment therapy, it appeals to us because it's really about that universal uh, understanding of being mindful and accepting that I'm going to have these thoughts, but I'm also committed to my own personal values, and I'm not going to let those some of the negative thoughts affect me. We like to use metaphors, and I'm a big fan of that myself. Uh, we're learning how to integrate the spirituality piece. I learned from folks in our um, uh, services here. I learned from the clients, and I've been reaching out to a lot of people lately. And here's a little bit of information about eagles, in case you didn't know what a group of eagles uh, was called. And that's all I have for now. But I do want to mention that I held back on a pun that I thought was a wise idea to not say. So I want to get credit for not saying it. So I enjoyed talking. I don't know if there's any comments or questions.
Great. So let me,
I can stop the share there. Is that okay?
yeah, that's
Okay,
great.
good.
Okay, we've just got a one question there, and maybe only have time for one question, but
Sure.
I've encountered several families from Alaska who have traveled to Seattle for medical care, often referring to it as medical vacation, quote unquote.
Mm.
Given the limited availability of certain medical services in Alaska, these patients frequently express frustration about the long travel distances and substantial cost to access the care needed. What strategies or resources could I utilize to better support these patients and families? Great question.
Yeah, that is. So I'm if I'm hearing it, what strategies to help them while they're on the medical vacation. And part of the challenge is knowing what the resources are, and part of the challenge is kind of accepting that there's not enough resource to go around. There is a cost to getting there, money-wise, time-wise, and I think that it goes back to something that I mentioned. Um, one of the things that we do is try to help our clients learn how to navigate the system, how to use the resources that are available to them. So I don't have a specific panacea for this one. I would say having the conversation, can you tell me a little bit more about what you're trying to access and you can't? Um, Getting more information about what their community looks like, and helping them identify uh, resources or knowledgeable people back home would be helpful. We often get calls, by the way, because what I said before, that we're committed to the human contact piece. We get phone calls from people because they know we'll answer the phone, and our approach is that we might not be able to provide the service, but we're going to get you where you need to go. So I guess that's my way of saying you can call us. Seriously, you can call us.
Great.
Good.
Sounds good.
Look,
All right,
look
let's
at
see.
what we've done here today. We've ended almost exactly on time.
That's perfect
Yeah.
timing. Yeah, yeah. Well, again, thank you so much. You really did take us to Alaska with both your information and your beautiful pictures. So we appreciate all of that. And as you can see, you're getting lots of
Yeah, I
thanks
appreciate
and
that, guys.
celebrations and love from
Yeah.
our audience.
Yeah.
So you've hit the mark. I think what
Cool.
people have been looking for. So thank you so much. Folks, thanks for joining us today. I'm wishing you all a very lovely weekend and look forward to seeing you next month. And we'll see you again then.
Thanks,
Thanks,
everybody.
Joe.
Bye.